Today's episode is brought to you by Microsoft Dragon Copilot, your AI assistant for clinical workflow, which helps to ease administrative burden, automatically document care, streamline workflow, and promote a more focused clinician-patient experience.
Love
I
that.
know you like that. Learn about how Dragon Copilot can transform the way you work. Visit aka.ms/knock-knock-hi. Again, that's aka.ms/knock-knock-hi.
Knock, knock. Hi.
Hello, everybody. Welcome to Knock Knock Eye with me, your host, Dr. Glockenflecken. This is your one-stop shop for all things eyeballs. And for today, also a few non-eyeball related things. I always touch on some eyeball adjacent topics, like the nose. No, that's terrible. I'll keep that joke in, but it's not good. That's like the type of humor people always ask me, like, what kind of humor do you have, like, in the exam room with patients? Like, are you like a stand-up comedian to your patients? Like, no, I'm not. I like to tell jokes because it does it make people feel at ease, especially when you're talking about eye surgery, if you can make them laugh. So I do, but it's dad jokes. Like that joke I just told is like a dad joke. And so people really like it. I'm not Dr. Glockenflecken though in the exam room. But anyway, I'm happy to have you join me today. We're talking about, I've got a few different topics. The first thing I'm going to do is tell you a story about government efficiency, pertinent to the news recently. And then we'll take a break. I want to address a few of the comments on my most recent post, particularly regarding the spleen and a little bit about United Healthcare. And then we're going to wrap things up with an eyeball topic. The topic of today, which is measles. We're going to talk about measles and the eye, another thing that is very relevant to society and things that are happening right now in this country. So first, this story about government efficiency. So this is something that actually I've never told this story on any of my channels, any video, any podcast episode, for a couple of reasons. One, it has some adult themes to it. And I do try to keep, ever since I had somebody at a conference bring their kids up to me and they acted out one of my skits in front of me on that day, I decided, okay, I got to keep this somewhat family friendly, in terms of my social media presence, because I think it's really cool if parents are connecting with their kids over these characters and the pediatrician and the radiologist and the ortho and all this stuff. So anyway, I try really hard to keep things, PG-13 at worst. So this story does have some adult themes. And so if you'd like to listen to this podcast with your family, maybe like skip ahead about 15 minutes. But it's not that bad. It's just a little bit different than my usual content. So that's one reason why I haven't talked about it in anything I do publicly. But also, it's almost impossible to believe. Like, it's a true story. At least it's true in that I heard this story secondhand. So it didn't actually happen to me, but someone I know was very involved in all of it, and so I believe that it was all true. But you're going to hear it and you're going to think there's no way that story is true. So, hey, I just take it from me, but it's secondhand. So who knows? Maybe there's some embellishment, but anyway, regardless, it's a pretty damn good story. And it's about government efficiency. And so I've been thinking about this story quite a bit over the past couple weeks as we keep hearing about Trump and Elon and the Department of Government Efficiency, it just basically holding funding from things like NIH research. And just yesterday, the House resolution bill, which would cut Medicaid services by $800 something billion. And now here's where I stand on all of this. Like, is there waste in government? Sure. Okay. Yeah. There's going to be waste. Like, we have a deficit for a reason in this country that's been there my entire life. There for sure is some The government could be more efficient with how they do things. I think, and most people are going to agree with that. I think the disagreements come with how they're going about finding what to cut and how much to cut. And this whole thing about Medicaid is a bit alarming, especially as someone who practices medicine. We see all insurances at my office, including Medicaid. And so we have a good amount of people who have Medicaid who come see us. And yeah, Medicaid doesn't pay very much. It doesn't pay us. We don't get as much money through Medicaid, but these are patients that don't have a lot of money that still need eye care. And so whatever, it's fine. Like we'll still see these patients because they need eye care, and we're the biggest game in town in Oregon, in the Portland area, aside from the university. And so anyway, we see Medicaid pay a lot of patients. And so hearing about like a potential $800 billion cut to Medicaid, it worries me for my patients. And so I don't know the best way to go about making the government more efficient. Maybe this is the best way. It doesn't seem like it, because it seems like it's really making a lot of people anxious. It's hurting a lot of people, which a lot of people are going to be hurt if we're trying to make cuts in different places. So I think we can argue about how best to do this, whether you do it a little bit more deliberately or just really just take a hacksaw to the government budget. I don't know. I don't know what the right answer is, but I am alarmed by the news about Medicaid. And so it's got me thinking about this story. So here we go. This is it relates to my experience in government healthcare, which for anybody who goes through med school and residency, your experience is going to be tied to the VA. That's where we, for the first time, most of us will experience government healthcare. And I personally, I love the VA. I do. I love the patients. I love the people that work at the VA. It's a much more laid back experience. It can also be very frustrating. Yeah, they're using a record system, CPRS, that was, I think maybe now it's updated, but back when I was in the VA, it had been around since like 1978 or something. And so there are certain things it does. Everything moves very slowly at the VA. Wait times are very long to get in to see doctors. There's a lot of frustrating things, but in the end, they're taking care of veterans, and at little to no cost to the veterans. And I think that's a wonderful thing. So this story has to do with the VA police. So the VA police, they're police officers that they patrol the VA. They keep everybody safe. They help deal with like de-escalation of angry people or family members or mental health crises. They're there to just keep people safe, as police officers do. And so they're, during the day, you can see them, they're walking around. Well, they also make rounds at night. And so the story goes, and I'm not going to tell you which VA this was, it doesn't matter. But the VA police were doing their rounds at night, and they were in one of the physician work areas. I don't know why. That's what they do. They just walk around. They just make sure everything's in order. No one's acting up or stealing things. I don't know. But they were in a physician work area, and they came across, quote unquote, pornographic photos. And they were alarmed by this, granted. And so they confiscated these photos that were in, again, a physician work area. And they decided they were going to open up an investigation. They weren't going to bring this to the attention of the physicians who work in that area. They wanted to try to figure out what these were, because what they looked like were not just like pornographic magazines or something. It looked like they were photos actually taken in that department by somebody, and of a sensitive nature. And so they confiscated the photos and they opened up an investigation. The investigation took about 7 months. And every so often they would go back to this area of the hospital, this department, and every week, every month, there were more photos, more of these pornographic photos that would show up. And they were very concerned by this, obviously. And so they collected more data, they collected more evidence, And then finally they brought this treasure trove. There's dozens and dozens of these pornographic photos. They brought them to the head of the physicians at the hospital. So like the medical director of the hospital, of the VA hospital. They had a big meeting. Very serious, very serious. They said, listen, doctor, we want to show you what we found in one of your physician workrooms in this department. And it's very sensitive in nature, but we want you to know that somebody has been taking what they called vagina photos of patients. We have dozens and dozens of these. We have evidence. Here they are. They laid all of these, what they were referring to as vagina photos. Never really heard that term or what exactly that meant, but they laid them all out, said, look, this is what we've discovered in our rounds at night. And the medical director looked at the photos and they asked the VA police, where did you find these? The VA police said, in the otolaryngology department, ENT. And the medical director said, congratulations, you've found photos of patients' larynx. You have found laryngeal photos, which is a thing that happens in the ENT clinic. They were mistaken by someone with no medical education or training as vagina photos. So right now, if you don't know what I'm talking about, go Google image search larynx photos to see what I'm talking about. I guess you can kind of, and then come back because I guess you could kind of like see how they could maybe think that looks kind of like a vagina. Of course, this story, I heard it from somebody who knows, who's like higher up in the VA. This story just like wildfire. Like I was surprised it get picked up by the national media. It's so funny and outrageous because obviously it was just normal medical care that was being given, but they were determined to get to the bottom of who was taking photos of people's larynxes. Like I have to assume it's a true story. It's far-fetched, but not so far-fetched that like it can't actually happen, you know? Oh man. I've been sitting on that one for a while. So anyway, so whenever I hear people talk about government efficiency, I do think about that story. Now, and I don't want to generalize this to like all of the VA like police. That's not the point here, because this is just like one hospital, one group of people that, yeah, they made a pretty big mistake. I mean, 7 months of investigation into this, that's a lot of man hours used to find like normal photos. How do you interpret that as a vagina? Anyway, so this is not like indicative of everything that happens at the VA. Obviously, the VA is a wonderful place, but it's a really funny story. And I assume that you find it funny too. I don't know. I it's always like, it gives me a little smile whenever I think about it. So anyway, let's take a break. Hey, Kristen,
Yeah,
I've got some friends I'd like you to meet.
I see that. You seem a little too friendly with them, I have to say.
Aren't they cute?
Sure.
With the little beady eyes
Uh-huh.
and their little hands. Are they hands? The claws?
I don't know.
Appendages.
Okay.
How about that?
Yeah, it works.
But anyway, they'd like to say hi.
Okay.
They'd like to say hi.
Okay. Wonderful.
Oh, look, the one's sticking around.
It sure is.
All right.
Right on my mic.
These little guys are Demodex,
Mhm.
and they live on your eyelashes.
Yeah.
And they can cause flaky, red, irritated eyelids.
See, that's not cool.
You just
That's
kind of
a
want to
party
like
foul.
rub them.
You're not welcome here if you're going to do that.
And it's caused sometimes by these little guys.
Yep, that's rude.
Demodex blepharitis. But you shouldn't get grossed out by this.
Okay.
All right, you got to get checked out.
Yes, get checked out.
To find out more, go to eyelidcheck.com. Again, that's EYELID check.com for more information about these little guys and Demodex blepharitis. All right, now you can invite your children back to listen to the rest of this podcast. I also think it's funny to think about like Knock Knock Eye as like a family gathering activity. Gather around like you're gathering on the radio. Let's listen to the eyeball, the comedian Eyeball Man, talk about rubella, congenital rubella, or measles, conjunctivitis, or crazy stories that happen at the VA. All right, so let's real quick, let's go through some comments on the most recent episode because I got some good ones here. So this is on the episode, United Healthcare is a wealth of content. And in this episode, I mentioned the spleen. I debated whether or not 2 livers would be better than a liver and a spleen. I still think it's obvious that we would benefit from 2 livers. Why not? The liver, it does amazing things. It cleans your blood. It has 2 circulations. It probably does other things as well. It breaks down like chemicals. It breaks down certain things that would be harmful to you otherwise. So anyway, and so I posed a question in the comment section. Again, the YouTube channel is at Glockemfleckens. I posed a question. I said, do we really need the spleen? Let me know if you're team spleen or not. And here are some of the comments. At Lid Jagillers said, it seems important. Fair enough. Very practical, yes. But maybe not as important as you think. At Castle 42 said, I want many accessory spleens. This is a big spleen fan. At Enroot said, multiple spleens is one of the most common anatomical variations. So I knew this was the thing. I didn't know much about this, but he says about 10% of people with accessory spleens, about 10% of people have accessory spleens. Sometimes if your single spleen gets exploded, get this, it will heal as multiple spleens. See, I knew this was a possibility. It's a thing called splenules, like these little tiny spleens that you get. I didn't put it into the context of if your if your spleen explodes, what happens? Like, can you get basically where your spleen tissue lands? You grow more little tiny spleens. And are they functional? I don't know. Do they have a blood supply? Well, they must if they're like turning into something. But it also makes me think like what other organs would be advantageous? Like if it exploded for some reason, that you would make like a whole bunch of baby organs, like the kidney. I think it'd be kind of cool, right? What if your kidney exploded and the exploded tissue turned into like dozens of little kidneys? We never hear it from the nephrologist. They'd be on such a high horse, just holier than thou, so much better. They'd have something on the cardiologist because if the heart exploded, you're dead. I don't think you'd have time to form dozens of new hearts before you're dead. So the kidney would be kind of cool. Adrenal glands would be cool. Testicles. I don't think it would be useful to have like dozens of little testicles. Actually, it would have been very useful for me if I had one instead of cancer in my testicle. If one of my testicles exploded, then I could have my other testicle taken out, and when I eventually got cancer the second time, and I'd still have dozens of little baby testicles that are still able to function somewhat. I don't know if it would work that way. Anyway, let me know what you think. What organ would you love to, if it exploded, you'd have a whole bunch of? The brain, obviously, but that goes along with the heart. If it exploded, you'd probably be gone before you developed dozens of little tiny brains. This was okay. Here's one. Here's a great comment. At Achior Jacobs says, no opinion on the spleen. I love this. I don't care what you're talking about. Here's my thoughts on something else. But I'd vote for multiple skins. This is interesting, you guys. Wouldn't it be cool to molt every couple of years? Maybe each new skin would have different melanin content, and we need mandatory vacations. James? Oh, yeah, he's having his 10th molt, and it's a big one. He'll be out of the office for a month. Then we'd be calling for more representation of public molting. People would post pictures of it. Um, yeah, I think it would be a big problem. I think it would be a bigger problem than you think. Because on the one thing, like if something happens to your skin, like say you get like a big scar you don't like, well then you just molt it and you get a new skin. That would be cool. So I think for people with like skin diseases, like yeah, it'd be awesome just to get rid of that one. You get a new one. But yeah, people would leave their molts everywhere. Like you just like nobody throws them away. They're just on the sidewalk. You walk go into the bathroom, someone's left their old skin, and it just and then like practical jokes would be out of control. People leaving their skin up somewhere, and you think it's a person, but instead it's just molted skin. I could foresee a lot of problems. I mean, think about how many skins that would be. We'd have to figure out what to do with all the molted skins. There are 400 million people in this country, 6 billion people around the world. Like, what would we do about every 2 months? We have 6 billion skins. What would we do with that? We'd have to figure out a way to use it for alternative energy, I think. Like that would be the thing to do. But then like if you burn hair, it stinks really bad. So it wouldn't smell good. I don't know. We have to figure that out. Some kind of alternative energy. There's maybe use them for as like a windmill. They can catch your skin could catch the wind. I don't know. Anyway, if you guys got ideas of how we can use our molted skin in this alternate universe to generate energy that could be sustainable, please let me know in the comments. In reaction to that comment, at Tractor Chick 1950 said, "I don't know what it was about your comment, but I think I just puked a little in my mouth." I'm sure a lot of you are probably feeling that way as well. Great comments. All right, here's another good comment from that episode where I talked about United Healthcare and their dedication to defamation lawsuits. Right, that's a thing now. Anybody who speaks ill of United Healthcare, they hired a defamation firm. They're going to come after everyone. Well, this comment from at Stephen McGinnis 5789, because I talked about how as a comedian and with my skits, it's satire. So I'm protected through freedom of speech from them coming after me, which is probably why they haven't yet at this point. He said, in the same way, so he talked about the Streisand effect a little bit, which is where if you point something out that you don't want people to talk about, but by pointing it out, you're going to make people talk about it kind of thing. Like when Barbara Streisand, there was a drone that took pictures of her house and she made a big deal about it, which all of a sudden brought it to the attention of the entire world. In the same way, there's a concept in defamation law called being defamation proof. This is an individual organization whose reputation is so bad that it cannot possibly be harmed. I would suggest that in the implication being that United Healthcare is in this category of company, which I think you're onto something. Like honestly, they're so powerful. Like what could we possibly make fun of them about that would knock them off their pedestal, that would make them less powerful? Yeah, it'll make people not like them. It'll make people not like United Healthcare, but it's going to remove their power. Not right away, but this is why I keep talking about United Healthcare, because eventually enough people will be pissed off that will actually enact laws or increase regulation that will strip away some of the power of these billion-dollar insurance corporations. So I wouldn't go so far as to say they cannot be harmed, but their reputation is already in the tank. So like, what do they care if people just make fun of them? It would be better, honestly, just like you're suggesting, to just ignore it. If I'm going to give them, like, as someone who's had a lot of angry comments levied against him over the years, like it's best to just ignore this kind of stuff and not hire a defamation firm to go after them, kind of like Drake did with Kendrick Lamar. All right. Anyway, great comment. There's another one here. Yeah, people saying satire is free speech. Hilariously, YouTube has decided to pair this episode with ads for United Healthcare. That keeps happening, but I think it's kind of funny. You're not gonna You're not going to convince anybody on any of my videos. So by all means, give me money, United Healthcare, in the way of like, you buying ads from YouTube. But you're not going to get anywhere with my audience, United Healthcare. All right. And just for the record, I have never, I would never, I have never, and I would never accept any money from Optum, from United Healthcare, from Cigna, from Blue Cross, any health insurance company. You're not going to see any of that shit from me. Never going to happen. I can promise you that. And then finally, last one here, at John C4403 said, I could really do with an extra appendix. John, you don't need an extra appendix. We take them out for a reason. All they do is cause trouble. You don't need one. He said they took mine out a decade or so ago, and it's one of those organs I don't have a spare for. You don't need one. Trust me, there's some organs you just don't need an extra one of. Some people would argue you don't really need an extra kidney. For some reason, they got one and the liver didn't. So I don't know. All right. So I tell you what, let's take one last quick break, and then we will come back, and I'm going to talk about rubeola, otherwise known as measles. All right, here we go, folks. So measles and the eye. So measles it's in the news. There's an outbreak in Texas. And actually, I just heard today, as of this recording, that the first death as a part of that outbreak has occurred. Very sad. And you can see this coming, right? With so much misinformation, so much negative publicity surrounding vaccines, that you're kind of waiting for stuff like this to happen, unfortunately. And so let's talk about measles. It's been worldwide for a long time a leading cause of childhood blindness. And unfortunately, it's reemerging in developed countries. So in 2023, worldwide, over 100,000, mostly children, died from measles around the globe. That's according to the World Health Organization. And then here in the United States in 2024, 285 cases required hospitalization. So it's one of the most contagious diseases out there, and it's airborne. It can linger in the air for several hours, and 89% of the people who develop measles had not been vaccinated against the disease. The measles vaccination works, folks. It works. It can save your life like so many vaccines. All right, you're not going to hear any anti-vaccine stuff on this podcast. All right, very much pro-vaccine in this house, in the house of Glock and Flecken. So blindness. Let's talk specifically about blindness, though. It's a very real threat. As many as 60,000 children are estimated to develop measles-related blindness per year in low-income countries that don't have high vaccination rates. And so let's talk about exactly how it can affect your eyes. So the most common way that the manifestation of the eyes that we see with measles is conjunctivitis. So you get pink eye, you get this red, watery, irritated eyes. It's really the hallmark of this with along with fever, cough, runny nose. And then from there, it transforms into the telltale measles rash, the red splotchy rash. And then what's the treatment for it? Well, there's none, right? You got to let it run its course. Unfortunately, with the eyes, you can develop more severe ocular involvement. So the conjunctivitis can spread to keratitis. So the conjunctiva, however you want to say it, either way is acceptable in the world of ophthalmology. The conjunctiva is it's a translucent, it's like the skin of the eye. It doesn't molt either, by the way. It's a translucent covering that covers the white part of the eye. So that when you look at someone's eyes, the white of the eye is actually the sclera. That's the tough, fibrous outer wall of the eye. That tough, fibrous wall is covered by this translucent tissue called conjunctiva, and that's where a lot of the blood vessels are. So when your eyes get real red, like you have an infection, you have pink eye, it's because the vessels in the conjunctiva are 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 inflamed. The virus is infecting the conjunctiva, and you need that conjunctiva because if it gets deeper, the infection gets deeper into the sclera. Well, then you're at risk of losing the eye because that, and then the infection can spread into this through the sclera into the eye. And so the conjunctiva is really it's a protection among other things, but it does protect the eye. And the cornea obviously is the clear, translucent covering of the eye. And so keratitis, which is inflammation of the cornea, is a very serious manifestation of a corneal infection. Right? So symptoms you get pain, you get tearing, you get severe light sensitivity when you have inflammation of the cornea. And the danger with any kind of corneal infection is that it can scar and lead to permanent blindness. And that's where the vast majority of blindness from measles occurs, is when you have a severe enough infection on the conjunctiva that it starts to affect the cornea, and you get haziness to the cornea, you get scarring of the cornea that causes permanent vision loss. The conjunctiva, pink eye, conjunctivitis, that heals. Your conjunctiva is fine. Like that'll heal up just fine. The cornea does not heal up the same way. That's why we take contact lens wear so seriously, and why we really hit any kind of contact lens related corneal ulcer. We hit it so hard with steroids. I'm putting patients on every 1 to 2 hours of topical antibiotic, not steroids. Sorry, we hit it with topical antibiotic because if you want to get rid of that infection as quickly as possible, or it'll scar. So unfortunately, in measles epidemics, measles outbreaks, you can get inflammation, significant inflammation of the cornea that results in scarring and permanent vision loss. And so basically those corneal ulcers that are developing as a result of this infection, it kind of melts into the cornea. And it's very painful. It's filled with the virus. And that can also increase the chance of developing a secondary bacterial infection on top of the measles virus infection. So you can get multiple different infections on the eye, and it all started with measles. Any virus can do that too. Herpes simplex virus, zoster. Usually you don't see it with just like rhinitis, like rhinovirus, your typical common cold viruses. But then those ulcers eventually will heal, but they scar over, inhibiting vision. Now there are a couple of much more rare examples of blindness caused by measles, and these are like reportable, like you could publish it in a journal. One would be retinopathy. So very rare, but there are definitely documented cases where measles virus destroys the retina. It gets into the back of the eye and it infects the retina and causes inflammation, and just the retina is very sensitive tissue. And so if that happens, it's toast, And so I found an article about bilateral macular retinitis as a presenting feature of a measles complication called subacute sclerosing panencephalitis, which is a delayed neurologic complication of measles. I don't know the pathophysiology of how that works, but you get on neuroimaging, you'll see panencephalitis, so inflammation of the brain, of the spinal cord. Well, guess what? The retina, that's brain tissue. That is connected to your brain. And so there have been cases where that subacute sclerosing panencephalitis, that delayed complication of measles, it migrates forward into the retina and causes blindness. Horrible, horrible things. And in the same way, in the same vein, you can also get optic neuritis. So that's inflammation of the optic nerve, which obviously very important. Relaying signals from the eye, what you see, to the brain. So you get inflammation of the optic nerve, that causes degeneration of the nerve, and you lose your vision. So conjunctivitis, corneal scarring, retinopathy, optic neuritis, and all these things can all lead to blindness. And so, like, what's the takeaway here? Like, don't get measles. Like, protect yourself, protect your kids, get vaccinated against measles. It's don't put yourself and others at risk. That's it. That's measles in the eye, everybody. There's so many different infectious diseases we could do still for knock knock. Oh, someone told me in a comment, they said, I really just realized we haven't done a don't do that eyeball tip of the week in a while. I'm so sorry. You are absolutely right. So your don't do that eyeball tip of the week is avoid the MMR vaccine. Don't do that. Not good for your eyes and presumably other parts of your bodies as well. Other parts of your body as well. All right, that's your don't do that eyeball tip of the week. I'll try to bring that back. I just have forgotten for like 2 months. Sorry. I've got so many good eyeball tips for you guys. So that's our episode. That's Knock Knock Eye. Thank you so much for joining us. As if I actually am here with my dog. Milo's in the back. He's sleeping. You probably have seen him throughout the episode. He's just laying there, farting up a storm. He's a stinky boy. All right. That's Knock Knock Eye. Thanks to my producers, Aaron Cordy, Rob Goldman, and Shanti Brook. Editor, engineer, Jason Portiz. Our music is by Omri Benz V. Just another reminder, go check out the YouTube channel at Glock'em Leave a comment. I see all of them. I'll read your comment if it's a good one. If it's pertinent to anything I want to talk about. If you have an eyeball topic, let me know. Something I haven't talked about. I'll even repeat some because I've been doing this for like a year now, it seems like. Maybe not that long, but happy to revisit certain topics as well. So let me know. Give me your suggestions. In the meantime, take care of your eyeballs. Knock Knock Eye is a human content production. See you later, everyone.
Knock, knock, goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts. Or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content. Hope you subscribe, leave a comment below. Let us know what you think.